Hello everyone. We are back with our fourth episode of Coffee and Conversation, and today's guest is Vaishali Ghosh. She has spent quite a number of years in the UK taking up courses, practicing and extending her services to a variety of clients. She grew up in Kolkata and has lived quite a number of years in the UK and specializes in person-centered therapy. She has done her training in the UK and has a vast amount of experience working with abused women in palliative care. She has worked in Mumbai, working with families experiencing violence and closely working with them on a day-to-day basis. Along with that experience, she is a passionate teacher, conducts workshops, also takes up supervision and is passionate about gardening. So today we are going to decode all the aspects of counseling and how people think counseling to be, and as professionals, what are the core elements into this profession. So with that, we welcome Ms. Ghosh. Hello friends, welcome to our fourth podcast, and we have our lovely guest Vaishali ma'am. Welcome you ma'am to the podcast, and thank you for taking out time to come here. So today's topic is very interesting. It's generally for our viewers who are therapists.
Okay.
So can we start with a rapid fire round? I have a few fun questions to prep us up, right? Okay. Are we ready?
Yes.
So if therapy were a food, what dish would it be?
For me, it would be an egg roll without any sauces, with a little bit of lemon, onion and green chili.
Okay, and how do you relate this with therapy?
So, it's nutritious, it's got protein, it's got carbohydrate, and it also has a little bit of the masala we need. You know, so like it's a wholesome food. So it has all the things you need. Okay. So for me, something I would look forward to, something that would fill me up, make me feel good, make me feel warm inside.
Yes. So it's a wonderful explanation. I hope the viewers get a viewpoint about what therapy might look like. Next question. If therapy showed up at our door as a person, what kind of personality would it be?
It would be somebody who is very warm, kind, somebody who's funny, somebody who's strong, somebody in front of whom I can laugh, cry, I can be honest, and I know I won't be judged.
Wow, that kind of sums up the entire theory which we had about therapists. So thanks a lot for that. Next, coffee, tea or therapy? What's your Monday morning fix?
For me, coffee any day.
Okay.
So I need a nice cup of cappuccino, something strong, something that will give me energy and get me going.
Okay, wow, great. What's the last thing you did that made you laugh at yourself?
I think trying out quite a difficult dance.
Oh, wow.
So yeah, so I am learning dance now
Yes.
as a self-care thing, which I'm enjoying. But I think sometimes I become ambitious and I try something which I really shouldn't be doing. But it's good fun, I think, and to be able to laugh at yourself is the best thing you can do to yourself.
Okay, okay. I have seen ma'am's dancing and it's great to see her energy. Okay. If stress had a theme song, what would be yours?
I don't know if I have a song, but for me it would be very loud music, like really loud that hurts your ears.
Okay.
I can't, and really flashy lights, something which is, you know, like it irritates your nerves. I can't cope with that. For me that would be too much.
Okay. If you could rename therapy to something less intimidating, what would you call it? This is for all the people who are wondering what therapy is, never tried.
I think it's like a medicine, but something that might taste bitter in the beginning, but then eventually when it's inside you and it starts working, then you're filled with a lot of warmth, courage, and you feel good and you feel strong. So for me, that would be it, I think.
That's a wonderful way of putting up things about therapy. What's your instant mood booster, no matter how bad the day is?
If I'm honest, it's calling one of my close friends who has good listening skills, even though she might not be a counselor, but I would call her and I would just talk and I would tell her, I don't want you to tell me anything, just listen. And that would be enough for me.
Yes.
So sometimes I am a person who needs to be heard, and I'm privileged and blessed that I have at least 3 or 4 friends like that.
Oh wow. Okay, so that's the power of listening.
Yeah.
What we
absolutely.
often discuss in therapy.
Yeah.
Right. Okay, if therapy were an emoji, which one wins the crown?
I think any of the hug emojis.
Yes. The warm hug.
The warm hug.
Okay.
Yeah.
Okay. So I just simply love those answers. So can we shift gears now and move on to more serious stuff? Not maybe serious, but something pretty interesting to know from a very seasoned psychologist. Okay. So I would love to know about your experience as a therapist and what are your viewpoints about therapy. What got you into this? Like what motivated you basically?
Actually, I entered the world of counseling quite by accident. So I was working in the UK at that moment, and I was working in a government organization where I was the coordinator of a program where we were helping people to go back to education, adults, mainly parents. And I saw this little course in the local college which said counseling skills. I can't remember exactly what attracted me, but it was only for 6 weeks. So I said I'll give it a try.
Okay.
So that was like a level 1 counseling skills, which really focused on doing work on yourself. And I think that was just so amazing, just learning, just doing the sessions, sitting in a group, and the tutor made us feel comfortable. She was a very funny person actually, not at all a serious tutor. She changed her nail polish every week. This is Sharon I'm talking about. And she was brave, she was honest, and this space which she created where we could be ourselves was just like mind-blowing for me. So that was my journey, and then I continued my training. Then I did my internship in the NHS Mind service, where I worked with young people, children. For the first time I worked with really angry men, which was quite daunting, but it was also I had a varied experience there. I was also sort of headhunted to go and work in a rape crisis center in a place called Darlington, which is in the north of England. Again, I just couldn't see what they saw in me, and I tried to push it away for a long time. But that also was a very, very powerful experience for me, listening to women. I was very privileged. I had very good tutors. I had very empathic, kind mentors over there who were willing to, hold our hands, who were willing to listen to us. So without their help and again the environment, it would have been a very difficult thing to do. So I finished my training. Then I came to Mumbai and I worked in the domestic violence sector. So I worked in 2 or 3 state hospitals. And again, once you're in that field, and you're with people who are so battered, not just injuries from physical beatings, but even the emotional trauma when you're working with young people who are drug addicts, who've been, often that was the first step, how young girls are trafficked, how they are sexually abused, working with them, working with their mothers, working with their families. It was, I thought it would be very hard and scary, but actually once you've got the skills And just for them, having somebody to listen to them was, it made them think differently.
Right.
I don't think we can change anything very fast. It will take years, and often the environment has to also change.
Correct.
For changes to be permanent. But so I had the privilege of doing that. Then I worked in palliative care for some time, and that was the first few cases I saw of people saying, I don't want to die. It was just so difficult, but it just made me realize how precious every single day was. So now I get up every day and I'm just grateful I can get up, I can do things. So I think I've been very lucky in all the opportunities I've got. And and I'm still on the journey.
Wow. It's great to hear such a varied experience. Now, I would love to pick up that word skill. So in therapeutic, like this profession, we often come across a lot of theory which is being taught in colleges. Now things are changing that yes, we have a lot of internships and all. Do you think skill, like the skill set and exposure is more important than just getting a license and a degree? Like which one do you feel is more important?
I think I'll quote my clinical supervisor who had done group therapy with us, and she had explained it very beautifully. She said we need theory, we need to study theory, we need to have theory and a tool set ready, we need it in our head. But when we are sitting with our clients, we have to be just a very ordinary person. We just need to walk with them wherever they are going, and we need to walk very slowly. So in our head, we might know why they are doing what, but we need to develop those skills of listening, of being really congruent, being really honest. And it's okay to be human. It's okay to sometimes say things which, maybe a therapist shouldn't say, because that is where the relationship is built. So we are not, if we sit in a very professional position with a lot of theory in our head and we are constantly explaining to people, I think that is more scary. They know there's something wrong with them, they know they're anxious. But I think just having that hour of somebody listening to them, not interrupting them, we don't have to agree with everything they're saying, but that emotional holding is the unique thing which we can give them. So I think practicing your skills, developing them, and for every counsel, I think going to therapy when you need to. I'm going to therapy at the moment right now because I'm doing some clinical supervision, and I just felt that it sort of brings back to you some areas of your life which you haven't dealt with.
Yes.
So the only way you can do your job properly is to go and again shake yourself and find out a bit more. Yes. And carry on with that. So skills is ultimate. You have to really work on your skills. And keep your therapy, like Carol said, keep it in your head. You know what's happening, but we don't need to express and impress our clients with our theory. The theory is a safety net for you, and keep it with you and use it. But be there for your client. Make them feel safe. I think that's very important.
So I love the word which you used, ordinary person, because many times we are confused as professionals how to put ourselves across to the other person, because they are already in a state of confusion and distress, and when we use all the heavy terms about diagnosis and going for psychometric tests, that's when the alarm bell rings. Another thing which is interesting is the timing. Like many of the clients who come to us, they feel that they should get healed very fast. So what is your experience about this, getting healing or getting cured in a way, what we say in layman's term, very fast? They're expecting that things will rapidly happen and they'll be fine.
So I think right in the first session, I think it's important to tell the client to sit and we're going to talk and I'm there for you, and we can look at all the bits of your life that you want to talk about. You can stop anytime, you can go away, and hopefully something will change. I'm there for you, but also making them aware they have to do the work, right? So that's what, the fact that we're very different to doctors. Mental health is far more it's much more daunting to
Yes.
deal with, and it's all the childhood stuff we have brought with us. It's all the environmental stuff that's happened to us. It's not our fault, right? All this has happened, but somewhere giving the client that power. So if a client comes to 2 sessions and then tell me I'm not coming back, for me it's fine, right? This is how much that client could do at the moment, right? Personally as well, I've done bits of therapy. Every time I've thought I've done it all. Now that's it. I'm sorted, I've looked at all the bad things in my life. I've punished those people. I've spoken about them. But then, if you're really honest with yourself and you're really able to reflect, then you'll know that, other things are happening to you as well, right? So therapy is never complete. It's never, you can never say, I've sorted out everything, and that's it, now I'm good.
Right.
So, no, it won't happen quickly. It will happen slowly, and it's fine. It's fine to come for 2 sessions, it's fine to come for 6 sessions. I think giving the power to the client, autonomy to the client, giving that person I think with adolescents, the main issue often happens is that they are being sent, right? They are being sent to therapy by the parents. We know as psychologists that a lot of the problems lies with the parents or the parenting. I'm not saying the person is bad, the parenting or the expectations. So when often they come for therapy, they are so determined that they won't do therapy. So I'm very cool with that, and I say it's your choice. If you do you really want to do it? Not really, but my mom will get angry. So empowering, even that little bit of choice that we give them, right? That is something they learn and take away. So I think even that one session can be very important.
Very powerful for
very powerful. Just learning, yes, I have a choice to say no. Somebody has given me the permission or told me it's okay to not come back anymore. That's one of the most powerful interventions we can do, right? So, yeah.
So about your experience with women, so if you would want to share something about your experience with women who's battered, maybe abused. So you've done quite a lot of work on that field as well.
Yeah, I think with women, maybe because of the nurturing nature that we are born with, the way nature has made us, right? The fact that we can give birth, we grow a life inside us, and the extra doses of kindness I think we've been given. I'm not saying men haven't, there are some very kind, empathetic men, but also the way society has conditioned us, we put up with a lot of unfair things for a long time. And the biggest challenge is to recognize that this is abuse. So a man who is being very loving one day, being very abusive the next day, being very loving the third day, really messes up our minds, right? So we really want to believe the world is a good place, a kind place, and we are very conditioned to take responsibility. If your man is doing this, it must be your fault in some way, right? So that is one of the biggest challenges, I think, of helping women to realize that no, they are not responsible for somebody else's actions or words. It's okay to say no. It's okay to walk away from a relationship. It's okay to look after yourself first, not in a selfish way. Again, sometimes that's taken in a very different way where self-care becomes selfish self-care. But it's that looking after your emotions, your mind, and looking after yourself first. That is one of the biggest challenges that I think maybe we also face as women, I'm of an older generation than you. I'm glad that younger generations are becoming more aware and assertive and independent. But yeah, I think it's still going to take a lot of time. And the pendulum shouldn't swing right to the other end where we have to mirror something which is very different to our nature. I think it's very important to stick with your authentic self.
So it's basically empowered women, which we label it these days. It's not only about being, aggressive and being ahead of men and something of that sort, because somehow even I feel that we are losing out our core aspects, like you said, the softness, the empathy, So with that, how do you feel women can access these attributes, in a very mellow way? Or what is your experience in therapy sessions if you have had women who were battered or abused? And what are the other aspects which might be stopping them from taking actions or going ahead with their plans? Maybe they are earning, maybe they are well established, but still they can't take a stand.
I think from my experience in my work in India, one of the very little spoken topics is that often women who experience a lot of abuse in their marital homes have already experienced it in their natal homes.
Okay.
So one of my friends, I have to quote her here, Sangeeta Punekar, who's worked a lot in this field.
Okay.
She actually, we've had a lot of discussions around this, and she said, look carefully, Vaishali, look carefully, right? So the women who are experiencing a lot of marital abuse, it doesn't have to be the poorer women or middle class, it can be any. It is very often even in the richest strata of society, where they have already been like discriminated. A brother has been given more preference in terms of education. Even when food is laid out on the table, right? The better pieces of mutton are given to the son. Anything like that.
Yes.
So what happens is that young girl's mind already gets conditioned that I'm inferior, I have to put up, it's okay to be treated like that. And then when she goes into her marital home or she's with a man, of course a lot of young people are not marrying now, they are in a live-in relationships. Yes. So already their mind has been conditioned like that. So, sorry, but as parents, it's your duty first to look after your daughter, to give her the love, respect. You have brought her in this world, and it's your duty, yes, to make her feel good, make her feel strong, because once you do that, her vibes, her confidence, it's not about always earning, Ria, Again, it's a choice of a woman. Correct. Like I have a sister-in-law who's very educated, but she wanted always to be a homemaker.
Okay.
Of course, life had different plans for her, so she did stuff. But she's still very proud of everything, of looking after her home. When you walk into a home, it's like walking into a therapy room because she's put so much love and warmth in that home. Yes. So it is every woman's choice. Empowerment is when you have the choice.
Correct.
And as friends, as family, as anybody, it's our job to nurture people and to step in. Sorry, I'm just speaking a lot. But how the general idea is the domestic violence is personal to the family where it's happening. No, that is wrong. It is the responsibility of everybody around who's heard about it, who is seeing it. If everybody takes a responsibility, steps in, says no, hopefully all the dowry deaths and honor killings will have to stop one day, right?
Correct.
We can't just turn our face away and say that's not my problem.
Yes.
It's everybody's problem because it's a problem of humanity, right? That the human being is being treated so badly, having to lose her life, it just shouldn't be happening anymore.
Correct. Absolutely. So let's shift focus from women now to men.
Okay.
So men out there must be wondering, oh my God, it's only about women. No, we also have men who are coming for counseling. So as we look at men who are coming for counseling, we feel that it's like something they are doing, some achievement like that's portrayed in the society. So what's your experience with men, or do men come that often for therapy? And why do you feel that they generally hinder in coming to therapy?
Again, it's about our culture, environment where boys have grown up hearing don't cry. So as a little child, whether it's a girl or boy, she falls down and scratches her knee and she will cry, right? So a girl is picked up and cuddled, where usually the boy will be told, boys don't cry, right? Get up.
Correct.
And often the kind of experience they have from the male figures in their life, whether it's a father, uncle, grandfather, if they believe in this, that boys should not cry, and it's imparted onto that little boy. He grows up with that feeling, and that is the most unnatural thing, that you can't express your emotion.
Yes.
That knee scratch is just a hurt that has come their way, right?
Yes.
So when they are older, when something's happening at work, something's happening at home, when the relationship is not, the fact that you can't cry, that once it's in their head, how it's so difficult to take that label off. So that hurt and pain will come out as aggression, will come out as violence. I'm not at all saying that violence is right and there is no excuse for it. But what I'm trying to say is that let's nurture the nice qualities in men as well.
Yes.
And all the research has shown that both the genders should have the same kind of nurturing. If men are allowed to develop the mindset, which is happening now, right? So in COVID, we've seen a lot of men going into the kitchen and cooking up dishes, and I'm so glad, right? It's such a good thing. So they are getting an opportunity to do things which maybe was not seen at school, but now it's really cool. So that's good, you know. So encouraging men to develop their soft side, do a lot of the caregiving, which again I'll say now a lot of younger couples are doing. And there's so much more of equality, harmony, and the bonding. So often, you know, Indian fathers haven't had that opportunity. They were not, you know, they weren't allowed to hold their babies, whereas mums were or grandmothers were. And then when the children grew up, there's a lot of men who come and they have so much regret and so much sadness that I just don't have the same relationship that my wife has with my children. You know, I'm buying them everything, I'm doing everything, but that emptiness, right? So all these bits of emptiness and has to be filled up. So we have to work towards equality. So when that work is done, only then will we have more harmonious relationships where both people will be in sync. There's no need for any power struggle. And empowerment is not about women being aggressive at all, right? That's not empowerment.
That's not our natural self. It's way better to be soft and empathetic. So weaving that question, you know, about men and women, we move on to another yet, you know, very powerful experience which you have, which is palliative care. So would you like to talk about some of your experiences with the audience and how do you see life after that? It must be a very different.
Very different. Well, to be honest, if I can share, I lost my mother when I was very young, when we were in school, and suddenly, right? And that was a huge trauma. So in some way I experienced death when we weren't prepared for it. But in my journey of life, at that time I thought it was so unique and, you know, it's really something very bad that happened to us. But believe it or not, Riya, since then I've come across so many other people who have experienced it. I've lost one of my very close friends, who was the first counselor friend I had, to death like that suddenly at the age of 40, and she had left behind a little 5-year-old son. So death is bound to happen. It's inevitable. And the loss and the pain that it brings is never going to go away. We still have to carry on with life. What I learned, what was very important, which I didn't know from palliative care, was the whole concept of spiritual pain. So there's physical pain, the hurt, there's financial pain, where if that is the main person who's earning, he's going to be gone or she's going to be gone, how will the family like carry on? Social pain, what are people going to say, what's, you know, everything. But spiritual pain, you know, it's just this pain of a person who can't do something which was very important to them. So for a woman, like for someone, it could be, we had a patient who was in so much pain because the doctor was asking her, where is it paining? The nurse was doing her wounds. She was kept comfortable. She was pain free, but yet she was not. She was still very sad. So finally, you know, she was able to say that every morning when I get up, I used to have my bath and I used to pour water into my tulsi plant. And I can't do that now. So for me, I'm not even alive now. You know, I'm dead while I'm alive. So, you know, that solution of bringing that little plant for her, that spiritual pain, what is the most important thing for you in your life is very different to what is for me.
Correct.
Right? So understanding that concept of spiritual pain it was nothing to do with God. It was just, what does life mean to you?
Correct.
What does life mean to a person? And
every small incident in their life or something which they do maybe as a ritual every day, that is what is what makes up their life, you feel?
Like it just came to my mind. So I had seen this other lady whose spiritual pain, so she had Parkinson's and it's getting worse day by day, but she's a very spiritually inclined person. She loves God, and though she was married, she was a lecturer, her children have grown up. Even now I talk to her, and the only thing that is, she can't eat now because she can't swallow, so it's all pasted food. She doesn't care of any of that. She's telling me, Vaishali, why am I alive? I can't take God's name. I can't chant the mantras which I have to chant, right? So why am I alive? Again, I'm sorry, it's a similar kind of experience. But these are things which everybody doesn't understand. This is where, as counselors, we can come in, we can give that listening, we can try to understand that person's world. Even her own daughters can't understand it, right? So she sees visions. She is a very big bhakt of Sharadama. So she sometimes sees those visions of Ma. And suddenly her face will be full of happiness, light up. So her daughters might get angry with her. That we are doing so much for you, Mom. Why aren't you smiling, when we are bringing gifts for you, when we are playing your favorite song? And she tells me, Vaishali, they don't understand, My happiness is only when I can connect with her. My happiness is only when I can see her face, when I can say her name. If I can't say her name, what is my life? So I don't want to live if I can't do those things. So, and these words, they're such powerful concepts, which a doctor has. There are wonderful doctors in the palliative field where you have to be a very good listener. I again had the privilege of working with a wonderful doctor, Dr. Anne, and she could sit for hours. She could sit for hours just letting the mother of a child suffering from cancer talk. I've seen her sit for 2 hours once. So you have to have those qualities.
The patience.
The patience, but that's very rare, But as counselors, those are the areas which we can look at. It's not scary. It's the area. It's actually the things we're trained for, where we have those qualities, where we can become really good listeners. We can learn how to enter that person's world. Even if you don't believe in God, even if you don't believe in something else, whatever it is that keeps them going, right? And giving them that space to share what nobody else is understanding. For me, that has been so priceless, very beautiful.
A profound experience. And when you see those repetitive patterns coming in, like you said, spiritual pain, that's your observation about maybe each and every individual who's going through this immense, fear, pain, whatever we call it. So that's like a wonderful experience in its way. Moving on to the next question, how would you look at therapy maybe 10 years down the line?
It's actually quite a sad question, because the way everything is online and app based and chat based and AI based, already people are choosing that because often it's free.
It's quick. Also people want quick results, as I had asked you.
It's quick, it's free, it's very confidential. You can do it while you're lying in bed in the middle of the night. But I do pray and hope that it doesn't go that way, because the difference between therapy and anything else is the relationship we build, right? So everything is about the relationship.
Correct.
A person will heal, change only when we are able to connect with them, even maybe on a soul-to-soul basis. So because I'm a person-centered therapy and therapist, so Carl Rogers at the end of his life, he did say that eventually I have to say where I have been able to do very good work. I felt there was some other presence there was some other power there. And that can't happen with AI and ChatGPT or any of those things. It's that human to human connection and touch without touching such, but that connection, that relationship is the only thing that can help someone go forward. And yes, you can get solutions. I won't say that we can't depend on AI at all or things like that. So some of the things when we use CBT, when we need a rescue at the moment, the breathing exercises, they're all good. They're all great to do online, learn online in your own space. But I think to feel understood in the depth which you can't express as a client. That can only be done by another human being, or even a pet sometimes does it, right?
Yes.
But you need your dog with you, touching you, being next to you. So for that you need something more than a tool, right?
Correct. So it's more like a psycho education which people might get from AI in the future, but not the human connection.
It's not possible, I think.
Yes. I hope people who are listening would actually accept what Bab is saying.
I think you have to experience it to understand it, right?
Exactly. And also kind of summing up with the whole session, like you said, client-centered therapy. You have been practicing that for a long period of time now. So how would you kind of differentiate from the other traditional kinds of therapies like CBT, behavior therapy, or even talk therapy? So how is it a little different, and how do you feel it might help the client or someone who's seeking therapy in a different way maybe?
So client-centered therapy, again, see, we have to be honest here. Every therapy has its place and value. Right. We can't say client therapy is for everybody, client-centered. But what client-centered or person-centered therapy has taught us, which I believe and follow in now, is that the other person knows what's really wrong with them.
Okay.
So it's all about creating that environment where eventually they will be able to say, this is my real problem of pain. So it could be anything, like, for men, when they struggle with so many things, older men struggle with things which they can't talk about, sexual health, maybe, a lot of stuff. So they'll talk about everything else, and it's only if you're successful in your work that they will feel okay to say, this is my, so the solution could be very simple, right? But getting someone to feel comfortable and feel empowered that that can be done, it can be sorted out. So client-centered is believing in your client, believing they have the answer and they can find the solution to their problem. So it's very little of advice giving, it's very little of homework giving. Some other problem like a child who's scared of spiders, right? So their CBT can do a very powerful work. Their client-centered may not be the right option. She'll have to learn how to deal with it, step by step, desensitize and reach there. So every therapy has its place. But client-centered is about that deep healing, deeper healing.
Right. So about your supervision work as well, like how do you feel supervision work helps young budding, psychologists or even seasoned psychologists? As you said, you are also going for counseling sessions in order to get better. So how do you think supervision might also help professionals?
Yeah. Again, supervision is something which even I seek when I need to, though I know it's not mandatory in our country at the moment. But I think supervision is that safety net, right? And as a supervisor, as a clinical supervisor, we are still working for the client, not for the counselor. And we are looking at what's happening from overhead, right? So when we are working so intensely with the client, no matter what, we do bring ourselves, our life histories, our blind spots into the session. So the work of the supervisor is to keep an eye on it and to gently prod you to think differently, to show you a path. Sometimes counselors get stuck with their clients. If the client is stuck in something, stuck in grief, the counselor also gets stuck and then feels helpless, feels hopeless. So rather than sort of telling your client, I think we've done enough session, bye, which often happens, right? If you take it to a supervisor and you share your work, she or he can share their experience. She can see something which you are not able to see. So it should be something that should be available to everybody. Even if it's peer supervision, if it's something we can do as counselors, have group supervision, share our cases, discuss things, so we'll get the experience of so many more people. So
yes, so it's more like getting a third angle view and people telling you what maybe actually you're missing out.
Yeah, access to more skills and experience, a different way of looking at things.
Right. So if I have to ask you, if you could erase one therapy myth forever, like it's gone proof, what would that be? The most important one, according to you?
According to me, I hear a lot about just venting. Just vent it out. Just journal it out. Of course, that's a very good thing to do. It's out of your head.
Right.
But just venting or just talking is not enough, right? You can, because you'll find clients will talk about the same thing. They will keep feeling the same feeling. So they need someone else to first listen and then to help them think a little differently or to acknowledge what they're feeling. When they're venting, they're just saying the incident. They're saying, I felt very angry, I wish this, I wish that. But you need another person, sometimes even to challenge you, right? So that challenging never happens.
Yes.
That looking at it differently never happens. So venting is good to just get it out, but it's not enough. It's definitely not enough.
Gentle probing is required.
Yeah, you need some work. You need to see why it's happening to you over and over again.
Correct.
You know, so a counselor can do that work of helping you to look at yourself and find a way forward, right? Than being stuck in that same situation.
And that's another reason why we shouldn't go for AI. Okay. So what is more stressful to you? Asking for help or saying a no? And how do you think people actually look at these things from your experience?
Me personally, I think now I'm quite assertive, so I can say no. I can ask for help, but I've done some work on learning how to help myself. Okay. So for me, it's very normal to just go now, take 2 hours off, put my phone off and sit and have a nice cup of coffee because I know I need it, you know. Right. So it's, I've reached there now after a lot of work. But people, even young people, really struggle with saying. So paradoxically, people who are attracted to this field of work are all empathetic people, right? They're empaths. So we struggle to say no to people. Correct. Because we feel for them. When we are saying things, you know, we start feeling their pain and we don't want to give them more distress. Right. So learning to put up boundaries, learning to say no, learning to be unkind is, you know, sometimes how we are perceived. That is quite difficult, but we need to learn how to do that.
That putting our assertiveness in place.
Yeah, and putting the boundaries and knowing that the boundary is a good thing both for you and the other person. I can't be there for my friend every time. I might have gone with her for her to shampoo her hair once when she was very distressed, but I can't go every time. I mean, that's a very frivolous example, but it's true, right?
It's true, yes.
So sometimes we do things for our friends when they are very distressed, but we can't, if we need to say no to anybody, we should be. And to also our children, right? To say no to them. I think that is very difficult.
That is kind of a war situation, I feel. Yes, of course. So about saying no, we often face this problem of, you know, clients coming in and venting out a lot in the first few sessions maybe. How would you set, like what is your tip about boundary setting on the time? Like we have limited resources and time at one moment. So maybe an hour session is scheduled and then they cross over that. Like how would you suggest young therapists who are just working in this field to set a boundary and be assertive about it?
So that actually is the work of the counselor, of managing that hour.
Correct.
So, you know, whether you have a watch in your hand or you have your phone or it's better to have a clock in the room somewhere to the back of the client where you can keep a check on the time. And if a lot is being said, as you get towards the end of the session, 15 minutes away, start winding down, give the person a gentle reminder that we have 10 minutes left. So stop the session, tell them we'll talk about this the next week. And keep that last 5 minutes to sum up, to make sure they're in a good place to go. Because after that hour anyway you're exhausted and you have failed in teaching them boundaries, which is one of the biggest things which we have to learn, we have to teach our clients. So that responsibility lies with the therapist and you have to practice it and you'll become good. And even your client will know after a while that this much time I've got. So even if they're distressed, you have to say no. You have to say the session is ending.
Okay. One last thing I would like to ask you, if you could put a mental health message on a giant billboard tomorrow and you get that opportunity to do that, what would you say?
I would say mental health, there'll be no physical health until you have good mental health. So look after your mental health first. Only then can you even look at your physical health.
Wow. So thank you so much, Vaishali ma'am. It was a lovely conversation with
Thank you. Yeah.
And to all the audience out there, please do put in your comments how you liked our podcast. And there are so many amazing takeaways. And the entire description about the podcast will be in the description box. Do send us what all other topics you would like us to work on, and we'll bring it on. Thank you so much. Thank you, ma'am.
Thank you.